Today we'll be talking about the wall bug. The wall bug is a great way to progress your breathing, and we'll add in a little challenge. Wall bug is also really good for folks that have trouble with what we call rib flare, where their ribs kind of poke up toward the ceiling. So again, for the good core stabilization, you want your ribs and your pelvis lined up so that you can fill that whole canister with air and have good stabilization. So with wall bug, you have your head pretty darn close to the wall. You put your palms onto the wall. Elbows point up toward the ceiling as much as you can comfortably go. And then when Sandra pushes into the wall, you'll see that rib flare just automatically corrects itself. So sometimes it's better than me explaining everything. Keep your ribs down, push it to the wall, and you'll feel what it's like to have your ribs down. From here, now that your rib cage is lined up with your pelvis, work on getting your breath down to your pelvic floor. So Sandra's going to do some good deep breaths down to her pelvic floor. Again, you might notice a huge difference once your ribs and pelvis are lined up with good breath. Next progression, once you're comfortable with your feet on the ground, you can maintain good breathing, is we'll add a little challenge in. So you can put your heels on an exercise ball. A chair is fine. Exercise ball is going to be a little more challenging because it's unstable. Keep your knees at 90 degrees. See if you can maintain good breath down to your pelvic floor. Another thing you can start playing around with is starting to release the pressure from the wall and seeing if you can still maintain that good activation of your ribs down on the floor, lined up with the pelvis. Another cue some people do well with is think of pushing my hand into the ground. So think of pushing your mid back into the ground. That can also help bring the ribs down. And also a fake laugh, like that will also bring the ribs down. So however you want to achieve it is fine with me. Get those things lined up, start breathing. The next progression would be take the ball away. See if once you're supporting your legs, you can still maintain your breath. There's a tendency for folks to want to start holding their breath once there's more challenge. You always want to work at the level where it's challenging, you're having to think about things, but you're not holding your breath or cheating or losing your good alignment here. The next step would be adding in a little bit of more challenge, bringing one heel down to the ground. Notice the knees stay at 90 degrees. Good. So you're adding in a gait pattern. The next challenge might be taking your arms away from the wall. Again, can you maintain that alignment? Can you still breathe down to your pelvic floor? Another progression would be arms up, facing each other. Now start to add in a little extension. This is a big one for a lot of people with a tight back. They're going to start flaring up their ribs. So again, just gradually add in challenge. Stay at the point where you can maintain good form and keep going from there. Another one you can do is alternating arms and legs. Again, a lot of times you add in challenge, people start holding their breath, so pay attention. Once you're good at this, we'll transition you to active sit to work on your core from there. So if you find that you're arching your low back a lot and maybe you're getting your ribs down but your low back's arching, you just can't find that good alignment, a good thing to do is take your feet off the floor, bring your knees back a little further. You can rest your heels on a chair or on the sofa. That should help bring your pelvis back so that it lines up with your ribs and you can get those good deep breaths. So this is a good regression for folks that tend to have that sort of hyperlordosis where they're hanging out back here to support themselves. The next progression on this would be you would just start slowly bringing the chair away, work your way out to about 90 degrees. Make sure you can still keep your breath down. Then another progression might be lifting one heel just an inch, then lifting the other heel an inch. If you don't have a chair or sofa, or say you're doing this at your office, you can also regress here. You don't need the chair at all. Bringing your knees back will line up your pelvis. This is what you did when you were 6 months old and it worked just fine. Again, the next progressions from this after the heel lifts would be trying without any support at all, and then bringing one leg down to the ground, keeping your knee at 90 degrees. Great. If you have wrist pain with this, one thing you might want to try is placing a towel here, which reduces the angle of your wrist and might help. But if you have wrist and shoulder pain and you can't get in this position, skip this part, skip pushing into the wall, hold your hands here, and just really focus on, you could even put like a little ballpoint pen here or something, push that pen into the floor. So sort of this part of your rib cage should be touching the ground, and that will help bring that alignment without injuring your wrists or shoulders. Obviously with any homework, if it hurts, don't do it.